Hello. Good day. So today I'm going to show to you the histopathological features of pulmonary tuberculosis and how does it look like on the histology. So okay, so this is a biopsy taken from the lungs. You can see as evidenced by this area. You can see there's a lot of alveolar spaces. So we go to higher power. Alright, so you can see all of these spaces like I mentioned in my lecture. This is actually a lot of alveolar spaces here. So these alveolar spaces, you can see that it is lined by single cell lining, which is single it's a group, it's a type of sort of a squamous cells epithelium. So this is a single layer or single lining cells, and the whitish part here is actually the spaces where in which the air is flowing in and also going out from the lungs. And you can see within the alveolar wall there's a lot of small capillaries of blood vessels in which the ventilation and perfusions of gases occur at this part, which is the most important in respiratory in the respiratory processes. Alright, so we go to another area or another part of this tissue biopsy. You can see there's some degree of inflammatory cells aggregates in this area. For example, in this part, in these fields, you can see there's a lot of inflammatory cells forming sort of aggregates in this lung tissue. Alright, let's keep that in mind first and we go to other fields. Let's see if there is a lot of things. Alright, so you can see this in this part at the center of the field here. You can see there's a structure which consists of a pinkish material at the center, which is this structure is a bit circular in shapes or nodules in shapes. At the center there is the pinkish is a lot of pinkish material, so we don't know what it is, but we will have a look afterwards. And it is encased by a rims of some sort of cells or tissue, and the outermost part of these nodules is the inflammatory cell, in which you see at this time is a bit blackish or dark color spots or specks surrounding these nodules. So we go to medium magnification just in case, just to highlight what actually this lesion is. And you can see that there's a lot of necrotic tissue or necrotic debris at the center of the nodules. Alright, if you take a look at higher magnification, you can see there's some sort of cells or ghost cells or lineage of cells with some granular materials within it. So this is how a necrotic debris looks like. So remember, keep that in mind, that at the center is the necrosis, and adjacent to the necrotic tissue or the necrotic debris there's a lot of these kind of cells which having a clear cytoplasm, and some of it has oval or elongated shaped nuclei with a prominent nucleoli. So if you like to try to guess what it is, I will give you around 2 or 3 seconds. Alright, if you guessed that is the epithelioid cells, then you are correct. So yes, there's a lot of epithelioid cells surrounding this lesion. particularly around here. You can see that these cells having a elongated shaped nuclei, or sometimes they describe it as slipper shape, but that is a very vague comparison, because not all slippers are the same. But the most important thing that you can see that these cells are elongated or oval in shapes, having an elongated or oval shaped nuclei. Alright, so apart from these epithelioid cells, so as you know that this epithelioid cells is actually an activated type of macrophages, and this type of macrophages also tends to fuse and become groups together and to form multinucleated giant cells, like in this picture, in this field. So you can see this is one multinucleated giant cell. So so you can see two multinucleated giant cells. One of it is here. I put it in the center here. You can see there's a very large cell with oval shape or round shaped nuclei, and within the cytoplasm there's a lot of the nuclei. So like in this case, you can see there's around 5 to 6 nuclei within the cytoplasm. So this is how multinucleated giant cells looks like. So as the name implies, it is multinucleated and it is giant cells. So giant, if you compare it with other surrounding lymphocytes and also other surrounding epithelioid cells, so that is why it is considered as a big or giant cells. So this is another one. This is another multinucleated giant cell. So like in comparison to previous one, this one has a lot more nuclei within it. So you can see that it is the nuclei is still the same, and if you compare with the surrounding epithelioid cells, the nuclei is also the same. This is because it is the same cells rising from the macrophages. So multinucleated giant cells, as I mentioned, it fused the few histiocytes or epithelioid cells or reactive macrophages fused together to form it. So you have necrotic debris at the center there. Number two, you have epithelioid cells and also multinucleated giant cells rimming around these necrotic debris, and the outermost part contains a lot of lymphocytes. So these are the lymphocytes. You can say that this is a lymphocyte. Number one is it's very difficult to see their cytoplasm. This is because the lymphocyte has a very scanty cytoplasms, and apart from that, there's also some plasma cells that are seen in this area. So plasma cells, in compared to lymphocyte, has a bit more cytoplasm, and the nuclei is a bit eccentric. Eccentric means the nuclei is at one side of the cytoplasm, and the other side of cytoplasm usually just contain other cytoplasmic materials. So you can see there's some plasma cells with lymphocytes at this area. So okay, so we go under low power again, low power magnifications. Okay, anyone, if you like to guess, I will give you 2 or 3 seconds and I will come with the answer afterwards. So what structure is this? If you answer granuloma, then you are correct. So this is a granuloma. Particularly, this is an caseating granuloma. So because why this is called caseating granuloma, this is because at the center there is very necrotic. So you have a non-caseating granuloma in which there's still the presence of histiocyte and also multinucleated giant cells, but there is no elements of necrotic at the center there. So in this case, this is a caseating or necrotizing granuloma. So in what case that you can see necrotizing granuloma of the lungs? Well, if you answer pulmonary tuberculosis, then you are correct. So usually you can find cascading granuloma in the pulmonary tuberculosis cases of the lung, or sometimes also you can see TB lymphadenitis or tuberculosis lymphadenitis. You can also see this type of granuloma within the lymph nodes. So again, this is a very big cascading granuloma. You can see the similar structure, but the size is a little bit bigger compared to the previous one. So again, the structure is always the same. It has a necrotic debris at the center here, with epithelioid cells surrounding the lesions, and sometimes you can see some multinucleated giant cells at the periphery of the lesions, like here. So this one contains a lot of multinucleated giant cells, with one very large giant cells containing abundant abundant nucleus within it. And adjacent to this structure, as previously, you can see there's a lot of inflammatory cells seen encasing this structure. So this is how granuloma or cascading granuloma looks like. So I hope you understand, and if there's any questions, I'm happy to answer it for you. So I end with this video with the low magnifications of the cascading granuloma, so that you can appreciate it well. Thank you. Squamous cell carcinoma of the lung. Hello. So today in this video, I'm going to show to you regarding the histopathological features of squamous cell carcinoma. So you can see in these fields, there's a lot of fragments of tissue. So fragments mean groups of tissue like this one, and all sort of these things, and islands of pinkish material here, or all are the fragments of tissue. All right. So but you can see the color of these fragments of tissue is a bit pinkish in color. So I will show to you what it is when we go higher power. So again, you can see, just for orientations, there's a lot of fragments of tissue here, and you cannot seem to find any other clues that indicates from what does these this tissue was taken from. But anyway, as I mentioned earlier, that this is a biopsy from the lungs, and this is a case of squamous cell carcinoma, so that will help you to orientate. So this is the higher power, the medium power, to evaluates the tissue fragments. Okay, number one, we go at the pinkish area first. So this is the pinkish area that I mentioned previously. Okay, that you can see under low power, it's just pink tissue or fragments of tissue without any obvious structure. This is because all of these things is actually a necrotic tissue debris. So you can still see some degree of cellular formations or cells, but the most importantly, the nucleus is not there, and it does not seem healthy at all. The cell membrane is also not seen in this case, and because of the cells died in groups. So this is how a necrotic tissue looks like. So just a pinkish material. You can still outline the cells, the shape of the cells, but you cannot determine what kind of cell is that. because due to the extensive necrotics that occur in this tissue. Alright, so we go to the the available viable tissue here. You can see there's some structure forming here. So if you pay attention closely to this tissue, you can see that there's an epithelial elements and also the stromal element of the tissue. Alright, okay, so we go higher power to just orientate it. So before we go to higher magnification, I just like to show to you that the epithelial element is the one that arranged in the groups of cells. So that is the epithelial elements, and the surrounding, which is a bit pale in color, is the stroma. And as you can see under the medium magnification here, the stroma is a bit desmoplastic. So this indicates that there is some degree of invasions towards the surrounding tissue. So because desmoplastic stroma is a reaction of normal tissue against any kind of invasion, let it be either malignance, or sometimes inflammation also can cause desmoplastic reaction. But we can see most of the cases of malignancy, the surrounding tissue try to contain these invasions by the malignant cells by forming a desmoplastic stroma or desmoplastic reactions. So they try to stop the invasion by the malignant cells. So this how does desmoplastics looks like. So if you see under higher magnifications, like here, you can see there's a lot of fibroblasts or fibrocytes within this desmoplastic stroma. And apart from that, you can still see these atypical cells that are present here. So you can see that these cells is a bit sort of polygonal and having pleomorphic or atypical nuclei. There's some variability in size and also shapes of the nuclei, and if you look closely, some of these cells do infiltrate within the desmoplastic stroma, just above or just beneath the lesions or the epithelial cells here. So you can see it infiltrates in a single cells pattern. So this indicates there's some degree of infiltrations into the surrounding tissue. So we need to find other clues that to suggest that this is a squamous cell carcinoma. And as I mentioned in my lecture, the best evidence to say that this is the squamous cell carcinoma is to find the keratinization of the cells. So we need to prove that these cells do produce keratins. So if there is a keratin, then we can say surely that these cells or these atypical cells is the squamous cell carcinoma. Okay, here you can but bear in mind, keratinization is not just in a type of keratin pearl, but you can also still see keratinizations occur in a single cell, or sometimes we call it a single cell keratinization, or single cell keratinization. So but in this case, I think there's not much there's no keratin pearls that can be seen in this biopsy. But what we can see is the individual cell keratinization, like in this area here. I try to focus it first for you. Alright, you can see. Alright, you can see that this cell, this one cell is a bit having a pinkish, pinkish cytoplasm instead of less pinkish or less a bit pale compared to this one. So this is the individual cell keratinization. So this is how it looks like. So to look for individual cell keratinization, you'll have to look for the color of the cytoplasms. And apart from that, if you remember back my lecture, so I try to focus here, you can see the intercellular bridges, in this squamous cell carcinoma. So if that's another point to prove that this is a squamous cell carcinoma instead of other type of carcinoma that you can see. So here you can see also some a few cells that has a gap between it, and in between these gaps you can see there's some projections in between cytoplasm to another cytoplasm of cells. So this is what intercellular bridges looks like. So bear in mind, so all the points are enough to prove that this is already squamous cell carcinoma. Okay, just for a recap, number one, there's a atypical cells having a pleomorphism or pleomorphic nuclei. Number two, there's a evidence of keratinization. Like in this case, there's individual cell keratinization, like in this field here. And number three is the presence of intercellular bridges. So all of these points towards the squamous cell carcinoma. So by that, I think you can diagnose it safely that this tumor or this tissue that had been given to you is squamous cell carcinoma. I hope that helps. Goodbye. So this is strips of tissue biopsy taken from the lungs. So you can see this there's a lot of blackish materials here, which indicates that the lung had been exposed to some carbon debris or carbon particles during the patient's lifetime. So it entraps the carbon particle, which is the blackish materials you can see on the fields right now. Okay, I'm trying to adjust it to you. So if you have a look at higher power, you can see that the particle is coarse, has a blackish color with a coarse granules that indicates this is the carbon particles. Alright, so on to our case. You can see this is one strips of lung tissue taken from the lungs. There's not much normal lung that can be appreciated. This is another part. This is another strips of tissue, but again you cannot see any normal lung parenchyma, which indicates the presence of the alveolar spaces here. So as you go higher power, so previously is under 4 times magnification, and currently is under 10 times magnification. You can see there's a clusters of cells here. Right, okay, there's a groups of cells. Okay, so there's a lot of groups of atypical cells arranged in groups or in sheets or in cords. Sometimes they use clusters. So this indicates that this lesion is actually a carcinoma, or it arises from the epithelial cells. So as you go higher power at this area, you can see that this atypical cells is formed by a mixture of cells that have variable sizes and shapes of the nuclei. Some are small, whereas others are large in size of the nuclei. And apart from that, you can see the cytoplasm is a bit clearer. So that indicates that these cells do secrete or do contain some things inside their cytoplasms. So you can see the surrounding tissue or the surrounding area, means apart from the atypical cells, the stroma is a bit desmoplastic, or having a desmoplasia or desmoplastic reaction. In other words, there's increase in fibroblasts and also fibrocytes within the stroma, just like over here. So you can see on your left hand side there's groups of atypical cells there, and on your right hand side is the desmoplastic stroma. You can see the desmoplasia is going on there. There's increase in the fibroblasts or increase in the fibrocytes at this area. And if you do concentrate on these groups of atypical cells, you can see that they are forming sort of a vague glands or glandular lesions. So that is your first clue that this tumor is having a glands. So when a tumor is form glands, so it is straight away you can say that it is adenocarcinoma. So bear in mind, in any places in the body, in any parts of the body, or any organs that in the human body, if the tumor or if the malignant cells form glands, then it is a adenocarcinoma. So that's one things to remember. So you need to identify the glandular formation. So at this area or in these fields, you can see there's one vague glandular formation. So what does make a glands? So glands, to say it is a glands, then you need number one is to have epithelial cells groups or lined together, and at the center of the these epithelial cells is the lumen that indicates that it is glands or it's formed tubules. So it is in a sense it is adenocarcinoma kind of lesions. So again, here there are some other atypical cells you can see with surrounding desmoplasia. You can see there's a elongated cells, elongated nuclei there adjacent to the groups of atypical cells. So there are the desmoplastic stroma, and the other thing at the center here is the malignant cells or the atypical cells that form the tumor. Here you can see there's another cells, the atypical cells with surrounding. You can see there's a lot of carbon particles in the stroma, in the desmoplastic stroma. So this indicates that that this patient or this person live in a slightly polluted area, so that there's a lot of carbon particles inside his lung. But bear in mind, majority of us do have these carbon particles inside our lungs. This is because there's a lot of pollution, air pollution occur currently. So that's why you can see that particles. So again, this one is another groups of cells, groups of atypical cells with one tubule formation at the center there. So if you in the exam or during your revisions, if you have this kind of slides and you look for you look for the glands formation. So if you can find one, then you can say straight away that this is adenocarcinoma with of course with other input or other findings as well. Number one, you need to have atypical cells. Number two, you need to have how do you say, atypical cells. You need to an evidence to say there's invasions there, which indicates by the presence of desmoplastic reaction of the stroma, and also the formations of the glands or the formations of the tubules to say that this tumor or this lesion is adenocarcinoma. So apart from that, you can see that within the nucleus there's a lot of there's a very prominent nucleoli at the center there. So this is of course when there's atypicality of the nucleus, so the nucleoli is also a bit prominent in compared to the normal cells, normal surrounding cells. Unfortunately, I cannot see, I cannot show you or the comparison between the atypical cells with the other normal glands or normal lungs parenchyma tissue, because in this biopsy there's only adenocarcinoma or only the malignant cells present within this biopsy. So again, you can pause this video here just to appreciate how does an adenocarcinoma cells looks like. So I will try to put in the description and also highlights on which are the things that I say during my my presentation now. So by that, thank you and see you in another video.